So this right here is my very own slam. It talks about safe sex, specifically the dental dam. For all you young lesbians who think you aren't at risk, have a listen and perhaps you'll change your mind after this. So first of all, let's talk about some background information. For example, how did dental dams come into creation? Dental dams were first used by dentists as an aid so that the bacteria during orthodontist surgery didn't transfer but stayed. You're probably thinking, how in the world does this apply to sex that is safe? Primarily, just to protect your body from getting a chafe. Dental dams are usually made of latex material. Although they are a one-time use, the safe sex practice should be serial. The sheet of latex is meant to support you from infection that can be sexually transmitted from multiple body sections. This can include oral vaginal or oral anal activity. With a dental dam, there will be no stoppage to your festivity. The dam is put on top of the body part you are going to stimulate. You must ensure that you use a new dam if sensation to a different area you will create. This involves throwing out the old and grabbing a new sheet, so the sexually transmitted infections don't have you beat. Please store dams in a cool and dry place, similar to condoms, but not in your wallet space. You may also want to use water-based lube before putting the dam in position. It may seem like a lot of work, but trust me, it's not a mission. So plain and simple, dental dams are for protection, so you can be safe when showing your affection. But before we get too deep, what exactly are you at risk for? What specific STIs should you be worrying about keeping out the door? There's chlamydia, gonorrhea, and syphilis too. Genital warts, HPV, herpes, and HIV, yes, it's true. There have been many studies supporting these claims. Unsafe oral sex is not something that should be considered a game. Some of these infections only require contact skin to skin. You don't even have to have penetrative sex with a digital toy that goes in. Although your partner may be a lesbian, it doesn't mean she's not infected. Perhaps infected men and women are previous partners she selected. Therefore, it is good to keep in mind that even though one may be gay, it doesn't mean that they've only had same-sex partners or that it will stay that way. This also goes out to physicians who treat based on sexual orientation. This leaves no room for those people who have done plenty of exploration. Thus, it will be best to focus on practices one has engaged in when offering advice. And don't be afraid to ask clients straight up. You don't have to be nice. Transmission of STIs between female partners is not rare. As many as 21% of lesbians from a study contracted HPV because for their body's health they did not care. What is surprising to see is that they never had any prior sexual contact. To people of a different sex, males they never did MAC. This is proof of female-to-female STI transmission. Dams will help reduce the risk but not cause complete risk abolition. The more sexual partners you have, the greater at risk you are. And you thought getting STIs from female partners was often the road and far. I hope you understand that the risk isn't that low. I hope you use a dental dam when it's time for the show. As a self-identified lesbian, you have a risk that is greater when compared to your heterosexual same-sex peers. Many lesbians receive less than optimal healthcare, and this brings about fears. Increased chances of contracting HIV and Hep B and C are linked because lesbian and bisexual women partake in unsafe sexual acts that are risky. As a lesbian, you need to take care and protect, not just yourself, but so your partner you won't infect. Now that you know the logistics behind the dam, I will tell you where to get them through this very same slam. Here in Kingston, you can get them at the SHRC, only $1 in vanilla or strawberry. The ones that they sell are latex from Glide Health Inc., but if you have an allergy to latex, don't fall off the brink. You can use non-latex condoms to create your homemade dam. Cut off the tip, the top, and down the length of the tube and bam! Now you can open up the condom to form a rectangular sheet. Unlike in a test, this is not considered a way to cheat. The good thing is that condoms are more cost-effective, and you can choose the material, flavor, and be selective. A glove can also be used in a similar way. Cut off all the fingers, but the thumb can stay. Then open up the glove and you can have a slit, so that your tongue can go in when you are stimulating the clit. If you think using saran wrap is another choice, there isn't enough research to support this voice. I hope you are not confident in your ability to protect yourself even if with your partner there is no chance of fertility. I hope you can see that using dental dams is not so hard, and we must work together to break down this guard. These are the damn facts about safe oral sex at its best, and I hope that to your friends this slam you will text.